That's very simple. A lap band is a device that is a purely restrictive device. So it restricts the amount of food that you can take in. Okay? So you eat, food goes into this upper portion of the stomach here, and it will restrict or decrease the amount of intake based on how much fluid and how much actual fluid we have in the band, which will restrict the size, the opening of this inlet into the remaining portion of the stomach. That's all a band does, okay? And a gastric bypass is a different procedure. A gastric bypass is also a restrictive procedure. However, it adds what's called a malabsorptive component, which we bring up a limb of intestine and we divide the stomach here. And so it has sort of the same size pouch as a lap band. However, that limb of intestine is sutured directly to the gastric pouch. Okay, that's called a gastrojejunal anastomosis. Then we reroute that down distally and we attach it to the small intestine again so that everything is sort of running through. So in a gastric bypass, your native stomach remains intact. We do not remove the stomach. We just attach a limb of intestine up here. The stomach is completely separated, but the intestine is attached there. So when you eat, food goes into this small pouch, which is about the same size of a band, and then goes, instead of trickling into the stomach, it trickles into the small intestine. And down through the small intestine, there's an area where you actually cannot absorb the calories, okay? Because it's a shorter route. Now, we've created a quicker transit from the actual stomach to the colon. So that area is bypassed. So you get an additional way to lose weight. So typically, gastric bypass weight loss is much more rapid and sustained than lap band. However, gastric bypass weight loss typically resolves in about 2 years, and most people stabilize their weight in about 2 years. The reason why the gastric bypass patients' weight stabilize in a couple of years is because A, they've lost a majority of their body mass, and the body will then sort of use its metabolism and slow it appropriately to sort of compensate with the actual food intake. So after a couple of years, the body will sort of equilibrate. Now, gastric bypass patients, just like any surgical procedure patient, including lap band, can regain their weight again. Okay, and the way they do it is you eat and you stretch the upper portion of your stomach. So you'll actually stretch this pouch until it becomes so large it is the same size as your native stomach or half the size of your native stomach. And then what will happen is it'll just create a reservoir for more food and you get hungry and you eat again. And that's why programs are so important. Having a program, we can catch these things prior to starting. That's why surgery is only half the battle. Programs are the other half of the battle.